Welcome to our weekly show for the National Association of Independent Medical Practices. You can find us at NAIMP.org. NAIMP is an organization focused on helping independent medical practices become more successful by providing innovative discussions, networking with like-minded professionals, and opportunities for growth, education, and increased revenue. Check out our website today at naimp.org.
Hi, it's Shirley Crest-Dudley, and welcome to our NAIMP podcast today. I'd like to introduce our special guest speaker, Mary Beth Gettens. Mary Beth Gettens is the managing attorney of Gettens Law. Their focus is HIPAA, healthcare privacy, and security. Mary Beth has spent years in business working alongside healthcare professionals, entrepreneurs, CEOs, marketing directors, human resource management, and other professionals. She is a tenured business attorney with a background in franchising and healthcare. Before entering the legal profession, Mary Beth worked for more than 9 years in the healthcare industry. Upon being admitted to the practice of law, she worked as a general counsel for national brands. She is an accomplished writer and speaker with published topics on both healthcare and franchising. Mary Beth is a member of the American Bar Association, the American Bar Association Franchise Forum, the American Health Lawyers Association, the Ohio Bar Association, the Legacy Center, and the Boomer Authority. She's been a guest contributor on the Boomer Authority, Blue Mau Mau, and the Frange Wire, and we're excited to have her with us today. The topic for today is patient reviews and privacy, getting fans and making friends online. And I'm really excited about this topic. It's so relevant in today's world. Mary Beth, what is the general rule about patient information? Are there special considerations regarding the internet and patient privacy?
Sure. What works online is the same as in real life. So if you can't share information in real life, you can't share it online without a patient authorization. So we just kind of keep the same rules, but they apply to online things. That means like whether you post on Facebook or Twitter or LinkedIn or even on your website in particular. So really, if you're going to post about patient information, you need to get a patient authorization. But there are some particularities to patient authorization for online use. And we kind of have to adapt what a typical patient authorization would include. In a patient authorization, you must identify what information is going to be disclosed. Same goes here online. You need to talk about what's going to be posted. If you're going to get a patient to talk about their experience, you need to identify that. Also, you need to talk about the purpose. So if you're going to be posting on Facebook, maybe it's, you identify that it's going to be on Facebook, and it's going to be for patient education and information. Mm-hmm. The other area that is of particular concern is revocation. In all patient authorizations, you must expressly state when a patient authorization is going to expire. But online, that's a little different because you're going to post it, but it may remain there for a while. Once you post something on Facebook, it's going to be there for eternity unless you take it off. So you need to kind of state that. It's going to be posted, but it will remain online. Also, when you say posted, if you plan to retweet it or repost it, that's a republication, and so that's going to affect the publication date. The other area of concern is what happens about revocation. So typically, if a patient authorized you to talk to their Aunt Susie, if they have a falling out with Aunt Susie, they come to you and say, I want to revoke that patient authorization. I don't want you to talk to my Aunt Susie anymore. But online is a little different because the revocation only operates to what has already been disclosed. But online, we have to understand that posts are retweeted, If you like something on Facebook, it may appear on somebody else's feed. So all those things need to be disclaimed, and the patient needed to be aware of that. A lot of folks aren't really up to speed on the kinds of things that happen online as opposed to real life. And always, with any patient authorization, you need to follow the standard protocol for authorizations.
Well, what do you do if you get a bad review?
Well, and that happens. I mean, you see lots of people, and sometimes somebody's going to have a bad experience. And so you want to kind of look at, there's lots of things you can do. The first step is to look at if there's any inaccuracy or misstatement. You want to consider if you should reply privately to that individual alone. Also, there's options available, and we'll talk about this a little bit, about how to reply publicly. And then, of course, you can do absolutely nothing. Sometimes it's better to do nothing. And then the last option is a little more proactive. It's providing an avenue for complaints for patients. That's in a safe way that you can have a useful and productive dialogue. And we'll talk about how to do that. So if you want to look at the inaccuracies, when you look at Facebook and you look at endorsements on Yelp, they have done statistics and a couple years back about the percentage of fake reviews, and really quite high. And I think that's become kind of public knowledge. But it's something that providers may encounter in their own practices. A lot of times the fake reviews are, we're going to have a lot of our family or friends go and like us so that our Yelp reviews look great. Or they may even pay people. There was a whole episode on, where they're paying people to write reviews. It happens in restaurants. It may happen also in the healthcare industry. So, but there are a small minority where you may have a malicious fake review, where you think that someone, I've never seen this patient and she gave me a bad review. Who is this person? Those do happen. Also, you want to look at inaccuracy. So if somebody is reviewing you and they say completely erroneous things, what can you do?
Yes, that's so
really
scary, the fake reviews and misstatements.
Yes, they can be. And there's, I think there's a couple of mechanisms that you can use. And it depends on the form where you get it. Sometimes like what you can do on Facebook, if it's one of your fans, you can unfriend them. There's ways to hide it because you can, but that's quite the maneuver actually on Facebook. You have to go in and check your location and things like that. There are ways to go ahead and hide them. You can report them to, Yelp or Facebook or, and in LinkedIn, you actually have to approve any endorsement. So that's a little safer venue. But there is that option is to notify the host. Wherever that negative review is coming from, reach out to the host and see if you can give them the heads up that I think this is erroneous. Now, I know Yelp has done a lot of things with data mining where they try to filter out fake reviews. They're not foolproof. And at the end of the day, what we're seeing is that Facebook and Yelp and other sites are not policing it 100%. They can't identify everything because it's just so enormous. And their willingness to address every complaint from a provider is just not feasible for them. So the other option, is to take action against the actual reviewer, and that's maybe consulting legal person, or reach out to them privately and say, I think this is inaccurate. I think that maybe you've got wrong provider here. I don't think you've received services from us. You also want to look at defamation. There are claims for defamation. As we talked about patient information and the rules of real life applying to online, same rules for defamation. You cannot speak misstatements about people. You can't lie about people. There's actually legal recourse you can do for that. And that goes for online as well. And it's actually considered when you post something online, it's like publishing something in a newspaper. It's the same way. So there's definitely legal recourse you can take if you do run into that situation. It's going to really be more geared toward looking at the actual statement and figuring out if there's any claim there. So that's a real situation-specific kind of call. So, and I refer to replying privately. If you look at the sites, whether it be Yelp or Twitter, there's or Facebook, there's a way to respond to people privately. And but before we talk about that, I wanted to just kind of give a couple cautions here, because when you decide to take the step of responding to people about a review.
Yes, that's a question I know we really want to know more about, is what can we say? What can we include in public posts as a provider?
Well, definitely. There are some things you can do and things you can't do. I mean, I think we go back to our statement, unless you have a patient authorization, you cannot talk about patient treatment. So if a patient complains about a personal experience involving their health condition, you don't want to go on to an episode of, their medical condition and their course of treatment. That's definitely not the path you want to go down. I think as a first step is keeping some things in mind, and I've actually here on the slide pulled up some information from the Yelp website, because I think it's very useful, and it's something to read through before you take that step to respond to patients. And it gives you some great cautions and some great insights to, gain that mindset first. You want to realize that the reviewer is a paying customer, that, at the end of the day, we all want our patients to come back to us tomorrow, and we want them to feel good about the services they received and tell their friends. So realize, number one, that the reviewer is a paying customer, and two, they're human, and that's, like they say, they're very unpredictable, especially when people are upset or angry or going through a personal health experience. They will be unpredictable. So when you respond to them, you want to keep that in mind. And finally, that they are vocal. A lot of times people take different approaches when they're angry or upset. Some people are quiet and stoic. Others are very vocal and verbose. And some people take that vocalness to the internet. And so you don't want to exacerbate a problem that already exists by responding to them in a way that can inflame them further. And I want to take a moment. Here's a basic, frustration, is to acknowledge, one, is a provider frustration. When somebody posts about something and your inability is really limited, you feel like, you've been gagged. It's almost like a gag order. I can't respond to the person in the form that they're talking to me because I can't post online about their treatment. So that feels very enabling, and to recognize that first, that feeling of frustration. The comic was based upon this review that was on Yelp. And you can see that basically from this sort of post, she gives the provider 1 star, and she says, I came in hoping to reduce the appearance of a scar, and I was told it would by 50%. I paid $750, and, I don't think it's improved. So in that situation, reading it from the provider's point of view, she may say, well, it's because you didn't follow through. You didn't follow aftercare instructions. You would, if you were talking to the patient, you would talk to her about why that is, and her perceptions of outcome, how she got them, and were they realistic. Online, you got to do something a little different. You can't go down that individual voice to the patient. You have to talk in a more global sense. So let's say at the end of the day, you've either decided to or not decided to reply to the person privately, but there's also the option of responding to the patient publicly. And again, I think you need to keep the same things in mind as we talked about in the first set about paying customers, about the fact that, They're very vocal and they're unpredictable. So realize when you keep that in mind as well, but also understand that you're not just talking to the individual, but you're posting online, and that not just the reviewer will see this information, but also the general public. And I want to point out here, this is another thing from Facebook, and if you look on the screen in the little boxes on the left-hand side, it has a place where the reviews appear, and you can hit like or comment. Now, when we talked about there's avenues of how to respond to people, that's how you do it there. You can either comment to the person individually, and if you do so, your comment will appear directly below the reviewers or the posters there. So that's how it's done publicly. If we go back, I'm going to go back a couple of slides, and if you see, this is the Yelp review that we just highlighted. And you can see here where you have the option to send a message privately to the individual, and then you can also have a couple of ways to respond to the person publicly as well. It's also, again, on the left-hand side of your screen, and by clicking on those blue words, they'll pull up a link for you. So going back to the public privacy, again, I visit the Yelp website, and it gives you kind of a walkthrough tutorial on how to respond publicly. I showed you on the link, but here's the how-to instructions. You need to go to your business account, and again, just like on Facebook, when you hit the comment section, when you respond to the reviewer, it'll appear right below the commenter. And again, it gives you some cautions on what to say publicly. Again, they're very simple, and they should follow along with what you say privately, but you want to keep it simple and polite. And they say, Yelpers, you've even given Yelp, people that visit Yelp a name, Yelpers, that's great, appreciate, honesty, and like to know how and when businesses are making changes based on their feedback. So, and then it also talks about when not to respond publicly. And I copied and pasted this from the website because I think that it is helpful to stop before you take the avenue of responding publicly and say, is this something I want to do? And am I in a good space to be able to do that? And again, it provides a caution. If you're upset, you might write something that reflects poorly on your business. So you might, again, exacerbate that situation, or have the inverse impact that you're hoping for. Instead of trying to convince people that you're actually a good provider, you may do the inverse. And here's another comic strip, and this is, I brought this to the presentation because I think this is a wonderful example of how social media can have an inverse impact on your business, and without being intentionally so. This comic strip actually comes, it's a real, from a real case that involves where a doctor posted about a patient online, and the next slide actually shows it, where she talked about her frustration, the physician does. This is from Mercy Hospital out of St. Louis. This was actually appeared in Huffington Post, where she said that she, was kind of frustrated because one of her patients was a no-show and was late, and then in a rhetorical sense says, should I show up late for her delivery? A lot of times we, kind of in our private life go through where we post about what happens to us. We post about, things we've seen and things like that. We become very conversational, almost like a diary. And we post things in a very brief sort of way. And you can see the dialogue that ensued from her post. And this was actually an actual post that appeared on Facebook. And initially, you can see that the folks are kind of, agreeing with her. If it's elective, go ahead and cancel the the inducement. So you're getting a lot of support, but at the end of the day, what happened was that a broader audience began to read this post and really took issue with what she said. And in fact, when I had the cartoon drawn up and we made the presentation, there was, she says, well, I'm doing all this because the patient had a stillborn. And that's kind of raw, I mean, to put that out there in the public is to talk about someone in that sense. But I think it's very apparent that when you put things like this, realize that, even if you're getting a lot of positive feedback online, there's a lot of folks that are going to read it and are going to take exception. And what happened here in this case is that the hospital, Mercy Hospital, got a lot of comments from patients saying that this doctor was insensitive, that this doctor should, had a terrible bedside manner and should not see any more patients. And it was all because of this couple short sentences. So when you post, think not just about, the audience that's going to read it, not just maybe your coworkers and other patients, but the general public, and that it can be really taken illy and reflect poorly on you. Also, I think, when you look at it as professionals, we tend to use a lot of lingo that's common in our industry and maybe soften your language. I mentioned the word, stillborn is raw, so try not to use that. She previously, lost a child in delivery last time, so I understand. You see how if I change the words and make it softer, it's a little more palatable. So really, it's a caution about how to interface with the public online. And I was asked, what can you include in a public post? What can you say to people? And here's a list of 4 things that you can include, because we've talked a lot about what you can't. Mm-hmm. So what you can include is general medical explanation. So if there's an explanation of why the patient didn't see a reduction in the appearance of her scar, you can talk about that. You can say, generally, when this is the outcome of a case, it can be a result of, and list a plethora of things. Don't indirectly state the result. So be more of an educational kind of responder to this. Give statistics and general potential outcomes. So you could say, yes, 25% of patients feel that, their scar reduction is great, and give the source so that it's a third-party reliable source. It's not just you seeing. And again, keep it so that you're kind of like educating the public, because if you're responding publicly, that's what you're doing, is you're trying to not only educate that individual patient that's filed the complaint or posted the complaint, but you also want to educate the public. You want to take this moment to be actually a marketing opportunity and a way for education. Also, you can list possible general accepted courses of treatment. So if this is the outcome, list some things that she might do and others in her situation might do. Remember, when you're responding publicly, you're talking to the audience in general. And again, it's a way of having your patients view you as a resource, as a problem solver. So you can give those kinds of things. Again, don't channel it just in response to her complaint or his complaint. Make it a more global education opportunity. And then you can also provide links, or, go visit this website, or there's some great information found here. You can also, give other third-party websites or links or books or whatever that people can go to. And if you respond in a way that's helpful, then that's great. And again, you're responding to it in a way. You're going to the upper level there.
This is really good information. Thank you so much, Mary Beth. Now, while you take a moment to catch your breath, we're going to go to some brief commercials.
Great.
Internet marketing experts, know-it-all gurus, proclaimed internet geniuses, and guaranteed top spot on Google. Those are all terms thrown around like water on a rainy day. Everyone on the internet seems to know the secret to getting the top ranks on search engines. But who can you trust to get the job done? The cold hard truth for most small businesses is they need a solid, steady, and current online marketing strategy that, one, gets them the coveted #1 position locally, and 2, doesn't distract them from their own business, taking care of all the nuts and bolts. SCD Consulting Services is the one-and-all solution for your business online marketing needs. Contact SCD Consulting Services today. That's scdconsultingservices.com.
And now back to our show, Patient Reviews and Privacy with Mary Beth Gettens.
Okay, we kind of left off talking about what you can say to patients when they file a complaint or a negative review against you. And I created kind of a little bit of a formula, a kind of a pathway that you can take, and this can be used when you're responding to patients either privately, when you hit that comment button or send message to reviewer on Yelp, or it can, and then it can also be used when you're responding in public. This just is a great format to kind of have your reader follow along with you. First, and any time somebody files a complaint, they're doing it because they want to be heard. They're angry, they're hurt, they're upset, they're mad. So you want to let the reviewer know that they're heard. You want to let them know, deflate that energy by telling them that you hear them. I'm not saying here that you have to agree with them. I'm not saying that you have to tell them they're right. They just need to hear that they've been heard. So you can say, again, I keep drawing back to our example, which we talked about the patient with the scar. You can say to her, the appearance of scars can be very upsetting. So right there, you're telling her you hear her. You hear her frustration. So say something like that. A lot of the reviews that I went through as preparation for this talk was to actually go through and read some reviews online. I just went to Facebook and clicked provider, and I started reading through them. And a lot of them really have to do with PR, patient relationships. I came in and I waited a long time, or I asked for a copy of my medical records and things like that. So if you just tell them that, hey, we're great you came in, and sometimes that wait is a long time, or it can be difficult. We're all busy. The second step you want to take is to provide the resources or make a commitment. And we talked about how you can provide those resources in the prior slide by giving statistics and general information, links to other websites or books that can give them more information, possible solutions for how they can go through. Also, the other thing you can do in step 2 is make a commitment. So you say, I'm going to discuss this issue with my staff, or I have discussed this issue with my staff. Even if you say that you've done something in face of a complaint, people want action. People want to know that they can channel that energy into a place that's going to be useful. So whether it's getting more information or that you take them seriously and you've looked at it. And then the next step, it really goes back to the concept of using patient reviews as a way of a marketing call. It's close the comment with a call to action. So, and that could be, and you want to draw them back to you. Not just the patient that gave you the bad review, but also the public. If you're responding publicly, you want to draw them back to you. For example, if, we're going back to the patient with the scar, you can say, there's aftercare options that we can offer you, and I invite you to give us a call so we can talk through those. If they are complaining because their medical records aren't, they didn't get them on time, or they had to wait a little bit, you can say, I invite you to schedule another appointment with us. Or the one other thing that I was thinking of how to handle this is when they come in, if you're waiting a long time, make sure to let your healthcare provider know when you visit them. Make sure you tell us at the time of visit, because a lot of times people won't say anything. They'll run home and make a bad comment. Invite them to tell you about their unhappiness or their poor experience. if this ever happens to you, we want you to tell us about it. Let your healthcare, let our nurse know, let me know, let the office manager know. But if you're again listening them a way to handle this complaint in a healthy and a productive way. So again, 3 ways to respond that will create, hopefully, is aimed at deflating the negative energy that you're getting. Make yourself seen as a resource and, somebody vested in good patient relationships. And then also, again, selling yourself one more time to the audience and the reviewer. So one of the other options that we gave at the beginning of the presentation was to do absolutely nothing.
Yes, we wondered, what if we just ignore it or don't respond at all, just do nothing?
Yeah, exactly. I mean, a lot of times, with all that energy, your first instinct, your knee-jerk reaction is, I'm going to go up and stand up for myself, or I'm going to do this. But what if you don't? What happens? Well, first of all, if you look at reviews that are in Facebook, the more comments that you have, or if they put it in your feed, it'll drop to the bottom of your feed, and eventually it'll be yesterday's news. In essence, I know when we talked about doing this episode, we talked about people posting. There's a couple sites that you can actually create your own site as a way of slamming a provider. You can post elsewhere, but all the time that anytime there's energy given to something, or it's renewed, or it's at the top, it's going to get CEO. It's going to get search engine optimization. It means it's going to come to the forefront when you search something. But over time, if it's not responded to and nothing is done, it'll sink, because Google and Yahoo, that does all these search engine optimizations, they're always trying to provide the newest, the freshest, the most responded to. And if you don't respond to comments, if you don't respond to things on websites, it'll drop to the bottom of the feed. So if nothing else, you can take solace in the fact that, okay, if I just sit here, time shall cure all. And sometimes it definitely does. So it's definitely an avenue that takes a little bit of self-restraint, but it can be effective.
That's helpful to know, that sometimes we can just leave it.
Right. And sometimes there's that patient that you're never going to make happy. And there's going to be that patient, that person that always has to say the last word. And you don't know, as we said, they're unpredictable. People that are angry are unpredictable. I'm unpredictable when I'm angry. You are. Everyone is. Is that if you may inflame them and they may say more and keep going. So sometimes there's something to be said for silence. One of the other things, and this is the last idea that kind of came out of this, and in my reviews I saw this and was like, this is a wonderful idea, and I think that a lot of companies have done this, not so much in the health industry, but in other forms, like you get suggestion cards on your table or things like that, or they'll even to the point that some bigger brands will actually go out and take client surveys, because at the end of the day, we want our patients happy. We want them to come back, so we want to know what's going on and what they're feeling and what they like and what they don't like. And so one way to really get a tap on it is to have an avenue that's safe, that goes directly to you, that you can respond to, and that they don't have to resort to filing a Yelp thing online. Because at the end of the day, they just want to be heard. So let them be heard. Put a link on your website. And this is, a lot of folks are working with, website designers, and there's easy ways to do comment forms and things of that nature right on your website. And do that. Take a moment. And sometimes, you may get nonsensical stuff. You may get nothing. You may get dead air. But it doesn't take, it's not a huge endeavor to create a link. Tell us what you think link on our website. And they can click on it. It's very automated these days that they can click on a link, send a comment, and make sure to respond to them. If people, their first avenue is when they're angry is to actually probably go to your website. So don't let them go any further. Make a link, make it visible, give them an avenue on your site, in your venue, to complain and follow up using all those tools that we've talked about.
I think that's so important. I just want to jump in a minute because sometimes we want to ignore what's going on, or possibly when we're running late, the day is running late, and we know that patients are running behind, but just acknowledging it and letting them then give us some immediate feedback. That's so positive what you've said, and it gives them the opportunity to express their comments there in the office and not go home and post it on social media. That's wonderful advice.
Well, thank you. Thank you.
So I don't know if you want to give your contact information here. We're so thankful for your time and expertise, and we've learned a lot of helpful information today. If you can tell us how to get in contact with you if they have further questions.
Great, thank you. Again, I'm Mary Beth Gettens with Gettens Law. Our website is gettenslaw.com. That's Gettins law.com. Also, my phone number is 513-400-3895, or you can drop me an email at mvgettens@gettenslaw.com. And that contact information is on the last slide here.
Yes, and if you'd like to see the slides, then go to naimp.org, and you can view the slides from the podcast and view all the other notes from the podcast, and also sign up for our $10,000 new idea contest. So we want to thank Mary Beth Gettens from Gettens Law, our guest speaker for today, and we'll see you again next time.
Thank you.
Check out our website today at naimp.org.